Understanding dementia, signs, symptoms, and related diseases. Did you know that over 55 million people worldwide live with dementia, yet it remains a complex and often misunderstood condition? Every 3 seconds, someone is diagnosed with this condition. In this video, we'll explore what dementia is, how we can recognize its signs and symptoms, the associated diseases, and ways to manage its impact. Whether you're here to understand a loved one's condition better or want to learn more, this guide is designed to provide families with clarity, empathy, and actionable advice. Dementia is not a single disease, but an umbrella term for a group of symptoms affecting the brain, which affect memory, thinking, and behavior. These changes are severe enough to interfere with a person's daily life, relationships, and independence. It's important to clarify that dementia is not a normal part of aging. While occasional forgetfulness can happen to anyone, dementia involves more persistent and disruptive challenges, such as forgetting important information, struggling with familiar tasks, or becoming confused in familiar environments. Misunderstanding of the condition often leads to stigma or delayed medical intervention, which is why awareness is the first step in breaking the myths. The most common type of dementia is Alzheimer's disease, but there are other forms too. We'll explore those shortly. Dementia symptoms vary depending on the type. Spotting dementia early can make a world of difference in managing its impact. Here are some warning signs of dementia. Persistent memory loss, especially forgetting recent events or conversations. Trouble understanding visual images or spatial relationships, such as judging distances. Difficulty in performing routine tasks like making a familiar recipe or managing bills. Trouble finding the right words and maintaining conversations. Disorientation, getting lost in familiar surroundings or forgetting the date and time. Mood swings, personality changes, or withdrawal from social activities. These signs are more impactful than occasional lapses in memory we all experience. The earlier they are identified, the faster professional help can be sought. There are several types of dementia, each with distinct causes and symptoms. Let's briefly explore the most common ones. Alzheimer's disease, the most prevalent form, accounting for 60 to 80% of cases. Alzheimer's affects memory, thinking, and eventually the ability to perform basic tasks. It progresses gradually, starting with mild memory loss and advancing to confusion and severe cognitive impairment. Vascular dementia, often caused by reduced blood flow to the brain due to strokes or other conditions. Symptoms include trouble with problem solving, slowed thinking, or focus issues. Unlike Alzheimer's, it may come on suddenly or worsen in noticeable steps. Lewy body dementia involves protein deposits called Lewy bodies in the brain. It often causes memory loss, sleep disturbances, visual hallucinations, and tremors, creating a blend of cognitive and physical symptoms. Other types. There are rarer forms, such as frontotemporal dementia, which tends to affect younger individuals and primarily impacts personality and language. Each type shares overlapping symptoms, but has distinctive traits. Another factor to consider is sex. Women are more likely to develop Alzheimer's disease, while men have a higher risk of vascular dementia. This is due to differences in longevity, hormonal changes, and lifestyle factors. Understanding these differences can help in developing targeted prevention strategies. Early detection allows individuals and families to prepare for the future, financially, emotionally, and medically. While there's no cure for dementia, treatments can help manage symptoms, preserve quality of life, and slow progression. There's a lot to discover about the connection between Parkinson's and dementia, and I can't wait to share it with you in a future video. Let me know in the comments what you'd like to learn, and subscribe to stay updated. In continuation about dementia, diagnosing dementia involves multiple steps. Geriatric psychiatrists or neurologists may ask about the patient's medical history, run cognitive tests to assess memory or decision-making, and perform brain scans to look for abnormalities. Caregivers play a significant role by sharing observations of symptoms and behavioral changes. Living with dementia creates numerous challenges. Memory lapses can disrupt routines, while confusion about time or place can lead to frustration. Loved ones may struggle with communication as speech and language skills deteriorate. Mood swings and changes in personality further add emotional strain. Building a daily schedule, keeping consistent routines, and providing simple instructions can help those living with dementia feel more secure in their environment. Before we continue, if you found this video helpful so far, don't forget to give it a thumbs up and subscribe to our channel. Your support helps us create more valuable content like this. Now let's get back to it. Support begins with empathy. Recognize that your loved one isn't in control of these changes. They stem from the condition. Here are some practical tips for better caregiving. Be patient. Conversations may take longer or require repetition. Offer assistance without taking over. Encourage independence where possible to maintain dignity. Use clear, simple language. Avoid complex questions that may cause frustration. Recognize triggers. Identify situations, noises, or events that may cause distress and adjust accordingly. Dementia doesn't only affect individuals, it impacts entire families. The responsibility of caregiving can take a toll on emotional well-being, leading to fatigue, anxiety, or even burnout. Relationships may change as loved ones adjust to the new realities of the condition. It's essential for families to address their emotional needs as well. Caregivers should build support networks, take breaks when needed, and seek counseling or join support groups to navigate the journey with resilience. Caring for others is a labor of love, but remember to prioritize your own well-being. Here's how to achieve a healthy balance. Ask for help. Friends, family, or professional caregivers can share responsibilities. Prioritize your health. Ensure proper rest, exercise, and regular medical checkups. Connect with others. Join caregiver support groups to share experiences and find encouragement. By taking care of yourself, you'll be in a better position to support your loved one. Though some risk factors like age and genetics are outside our control, there are lifestyle habits that can lower the chances of developing dementia. Stay physically active. Regular exercise improves blood flow to the brain. Adopt a brain-friendly diet. Eating foods rich in antioxidants, healthy fats, and nutrients, such as leafy greens, nuts, berries, and fish, supports brain health. Engage your mind. Activities like solving puzzles, reading, or learning new skills help maintain cognitive function. Making a few changes around the house can make a big difference for someone with dementia, keeping them safer and more comfortable. Think about these simple things. 1. Clear away anything that could cause a fall and make sure there's plenty of light everywhere. 2. Use labels on things or pictures to help them find their way around. 3. Keep the atmosphere calm and peaceful to help reduce any anxiety or confusion. These small adjustments can go a long way in helping them feel more independent and secure. If someone you love gets a dementia diagnosis, it's important to plan for the future. This means getting things in order, like choosing someone to make healthcare decisions for them, if they can't, setting up finances so someone can manage their money, and looking into insurance to help pay for care later on. Talking to a lawyer or medical professionals who know about elder care can help you figure out the best way to do all this. Researchers are making strides in understanding dementia. Emerging treatments and therapies aim to slow disease progression or target its underlying causes. While a cure remains elusive, ongoing advancements provide hope for better management in the future. Families are encouraged to stay informed, as knowledge is key to empowerment. One of the biggest challenges in dementia care is overcoming stigma. People with dementia and their families often feel isolated due to misunderstandings about the condition. By starting conversations, sharing stories, and educating others, we can foster awareness and empathy within our communities. Dementia can feel like losing a loved one in slow motion, as their personality and behavior transform. Permit yourself to grieve these changes while also cherishing moments of connection. Counseling or therapy can provide tools to cope with emotional challenges. There are many organizations and tools designed to help families navigate dementia. Consider the following. 1. Alzheimer's Association or similar local organizations for education and support. 2. Online forums and caregiver helplines for guidance and connection. 3. Books or apps on dementia care for practical tips. No family should face this journey alone. Support is always available. Dementia is a challenging condition, but understanding it is the first step toward compassion and effective care. From recognizing early signs to adapting lifestyles and creating support systems, there are countless ways families can make a difference. What you've learned today can make a real difference. Please share this information with others. A simple conversation can bring so much understanding and hope to families struggling with dementia. Let's build a kinder, more supportive community. Thank you for being a part of this journey. If this video resonated with you, please like, share, and subscribe to continue learning and supporting each other. Let's create a healthier world, one step at a time.